Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural healthcare headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. The most urgent issue of rural health continues to be the proposed cuts to Medicaid funding. Voices across all political parties are now rising in opposition to this threat to healthcare access. While we wait for Congress to vote on the bill, possibly even this month, we would like to grant a platform to the affected families in our own community right here in rural Michigan. I'd like to introduce to you Nina Smith. She is a guardian of her sister, Carol, who requires regular hospital and assisted living care. I'll let her tell her story.
My sister was born in 1961 with birth trauma, so she is developmentally disabled, and she's been disabled from childbirth. And at 2 years old, she started having seizures, and so she has had seizures throughout her life. My parents both worked. My dad worked 3 jobs to help take care of my sister. They did not get help until she was 13. And then she was put on SSI and Medicaid to help pay for her medications and her health care. After my dad had passed away, she had been seizure-free, and then 3 years later, my mom ended up passing away. I became her guardian because she had breakthrough seizures after my mom passed away. Carol has been on Medicaid, Medicare, and Social Security from the time that she was able to apply. And they help pay for her hospital care. I had moved her from a care home that was outside of Hillsdale to a care home that is here in Hillsdale because I wanted her to be close to the hospital if anything was to happen. I didn't want her to be afraid of coming to the hospital and not knowing anybody. So I made the decision to move her here. Taking on someone that you grew up with, after you lose your parents, I have to be her voice. I have to be her voice and express how horrible this would be for her to lose her health care. It shouldn't be a Republican thing or a Democratic thing to care about each other. It just should be a part of humanity. You can be in the room with my sister for 10 minutes and you will realize that she is someone that has special needs and she needs to be taken care of. My parents worked to help pay taxes and pay into this. My sister worked. She worked at Wendy's for 18 years. She got Employee of the Month twice. So it wasn't like she didn't contribute. She goes to a psychiatrist, she sees a neurologist, she sees a urologist. She has so many specialists that she sees, and it's all through the hospital here that we come to. I think back about when my dad would be sitting at the table and he would be so worried about how is he gonna take care of Carol? How is he gonna pay for her medicine? And I'll never forget that. Even as a young child, my dad sitting at the table wondering, how is he gonna pay for the medication she needs? It is so unfair to make us have to go back to those years when people struggled because there was no safety nets. There was nothing to help. And I just think that I just don't understand how this could be happening. It just does not seem right. And I just hope, I pray that it doesn't happen.
On to the damage report. In our last news update, we reported 10 hospital closures in 2025 so far. But since then, 2 Insight hospitals in the Midwest have closed their doors after filing bankruptcy, and many other hospitals and health systems across the United States are eliminating hundreds of jobs in the wake of financial crisis. In Renton, Washington, Valley Medical Center gave no notice to 101 employees when they were laid off due to severed Medicaid funding to the hospital. The unstable state of Medicaid reimbursement also led Maine General Medical Center to lay off 100 employees, effective mid-April. Several dozen other hospitals and health systems are reporting job eliminations and hiring freezes as businesses' costs rise, reimbursement rates flagged, and insurance denials exceed what healthcare providers can afford today. All of this gives us a glimpse into what will happen to healthcare if Medicaid funding is cut. Healthcare is the largest private sector employee in Michigan and employs over 22 million workers in the United States. This is not a sustainable model to care for our country. If the House Energy and Commerce Committee is forced to cut $880 billion from the federal deficit, we will see states lose up to billions in economic output. Healthcare advances will backslide, and morbidity and mortality rates across the nation skyrocket. If you want to help us stand against cuts to healthcare funding, visit ruralhealth.us/advocacy to send a message to Congress. For today's success story, we travel to the state with the highest population of rural residents, the state of Texas. With nearly 3 million people living in rural areas, this state faces significant healthcare barriers, which is evident in the fact that 172 rural counties lack a hospital. The University of Texas at Arlington set out to improve rural health for its state with a mobile simulation lab led by the College of Nursing and Innovation Center for Rural Health and Nursing. It's all contained in a 40-foot commercial vehicle that travels through the rural communities to help expand healthcare and to give experience where it's needed the most. The lab is equipped with 3 simulation bays for advanced nurse training, including childbirth simulation and obstetric emergencies. This is groundbreaking to the state, as fewer than half of Texas rural hospitals even offer maternity care. Every rural hospital understands the importance of training the next generation of healthcare workers in their own communities, and breakthroughs like this inspire healthcare providers to think outside the box for innovative solutions. Thank you for our sources for this episode: Becker's Hospital Review, Maine Public, and University of Texas at Arlington.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.